Dr. Frank Tamburrino. He is an associate director of cardiology at Staten Island University Hospital in New York, and he wrote a post about his ordeal after contracting COVID-19. No air, he wrote. Flush of fear came over me. I went down to the kitchen and told my wife, please take me to the ER. I can't breathe. My daughters looked at me and started crying, Daddy, no, no, Daddy, no. Dr. Tamburrino, obviously your words have really struck a chord with people, and it's good to see you doing so much better. I'm hoping you can describe for our viewers your experience with COVID and how you're feeling now.
Well, I'm feeling well, thank you, but there's some residual effects, obviously, and we expect these things, and they'll last for some time. You know, look, this thing comes out of nowhere. We're all out in the environment. Healthcare workers were all exposed. It initially came on. I hadn't been aware I was exposed. I noted the fever. I knew the signs. The most alarming things were, the drop in my oxygenation. And I feel for patients. As a physician, I was aware of what was happening and the severity and the drop in my saturations into the 80s. Eventually having to go to the hospital for a second time. And at that point being admitted, receiving the treatments, and even get to the point where I wound up on BiPAP, a step before intubation. Very, very scary time. I mean, even just about to go on BiPAP and my daughter texting me, please, Daddy, what's going on? Why don't you call me? And, I couldn't even speak at the time. But, look, what I want to make a point to people is that this is real and it's a roll of the dice. You just don't know who's going to get sick, blood type, vitamin D levels. It doesn't make a difference. Some people are more prone than others, and you just don't know. I'm a healthy person. No comorbidities. I wasn't a candidate for Regeneron on my first hospitalization because I didn't meet any of the criteria. Yet, day 10, we know this can happen, and it did happen to me. I'm fortunate that the hospital have available treatments. We're wiser. We know not to intubate. We know to move into high-flow oxygen and BiPAP, and we do have therapeutics available like Decadron and steroids and remdesivir for viral replication and interleukin-6 inhibitors, as well as convalescent plasma, which is really a gift from another person. It's an amazing thing to be treated with something that can save your life, and watching it go in and knowing that somebody took the time to go and give that to you. And it's an amazing thing, our healthcare system. I'm very, very impressed. I'm very grateful. I'm very pleased. But the message I want to send to people from this is it can affect anybody. And that don't think you're exposed.
To that point, do you know how you were exposed? Do you know how you contracted COVID-19? And it sounds like you had a rather serious case of it. At the worst point, did you worry that you might not make it?
Sure, absolutely. I mean, I put my hands in the nurses that I've worked with for my entire career. When I saw myself going down again after I thought there was a chance I was getting better, and my own partner walked away, he couldn't look at me with my saturations dropping into the 80s. And they grabbed my hand and said, it's going to be okay. And, they put me on BiPAP, and I put my life in their hands like everybody else does. And I lost consciousness. I had passed out. I couldn't breathe. And, I came around with the BiPAP and then a lot of hard work from people to get me off oxygen. But as far as contracting it, look, as a frontline worker anywhere, in my office with patients, I had gone in the weeks prior. I do interventional cardiology. I stent people with heart attacks. We prepare and we make sure we test appropriately, but we treat them. Could have been exposure during one of those cases. There's a lot of different things. And out in the environment, children going in and out, people contact with one another. It just takes one or two people not to be diligent to infect one person. And it's very silent, the virus. It lives among us. I was probably with the virus 8 or 10 days before I had symptoms. I do contact tracing. I make sure my patients and family members were okay. But it's a scary thing how this virus can just get to people. And 10 days later, you either have mild symptoms or you have severe symptoms. It's a roll of the dice.
Given all that you endured and survived, what do you have to say to those who are on the fence or don't want to get the vaccine when it's made available to them?
So this is a very important point, and this is really the reason why I let that Facebook post become shareable. In the past, during COVID, we learned so much, and we treated patients in March, and I would make posts to friends and family just to let them know where we were, what to do, how things were going. But I never made them shareable. But with this, when I posted it, what I noted was people were texting me and calling me and saying, I didn't believe this, but I know you. You're a strong guy. I'm going to take this seriously. Or I was not going to get the vaccine, but now that I hear what you're saying, I'm going to get the vaccine. And that's why I made it shareable, because when I saw it, look, I'm a physician. I want to be known for taking care of people and saving people in the way that I do things. But, by seeing that people find this so important, and it opens up their eyes and their minds to the importance of becoming vaccinated, that's the reason why I let it become shareable. And that's the point I want to make. And I love seeing my colleagues all over, getting vaccinated in the ERs and in the hospital and the healthcare system. And I'm proud, because it's a responsibility we have to each other, our families, and also, long term, we need to eradicate this virus. We have a responsibility to each other to become vaccinated. We have to trust the science. I trust the science. Even as far as me, what do I do? Do I get vaccinated? I have antibodies. I've been exposed. And the recommendation is that, yes, sometime in around 60 to 90 days, I should receive a vaccine, and I will. And as far as convalescent plasma, I've already applied to give that. As soon as I'm ready, they say it's going to take 2 to 3 weeks, and I'm going to give my plasma in the hopes that I can help people the way I was helped.
And it sounds like, Dr. Tamburrino, that you are helping people in so many different ways. I appreciate that. Thank you. I want to ask you one last question. There are reports of a new strain in Europe, and health officials there, of course, say that it is not more dangerous, which I want to emphasize, but that it could be more easily transmitted. I do think, however, that there are some people who hear new strain and immediately start to worry. I'm hoping, can you tell us anything more about this, and if the current vaccines are expected to be effective against any new strains?
So I am an interventional cardiologist by trade. I'm not an epidemiologist or an infectious disease specialist. I'd have to leave that in the hands of the experts. There's always a concern, but there's a lot of commonality between viruses, and the hope is that there will be some degree of immunity. The main thing is the spread, and we need to develop herd immunity to this virus that's here. And the only way we're going to achieve that is through vaccination, not through infection. You don't want to get this virus and say, listen, I'd rather get it and get it over with. You just don't know how bad you're going to get it. It's a roll of the dice, and you have to protect yourself.
Dr. Frank Tamburrino, thank you so much for joining us and for sharing your message. I think that you're helping to save more lives this way as well.
Thank you very much. I appreciate it. Have a great day. Be safe.